Hello.
Hi, Mr. Foster. I'm Tori, and I'm with the Respiratory Care Department. And I'm here today because your doctor has ordered an arterial blood gas sample to be drawn from you. And that's going to be different than the other blood draws you've had during your stay at the hospital because I'm going to be drawing blood directly from the artery instead of the vein. And the reason we draw from the artery is because arterial blood is oxygenated. So this blood is going to tell us the pH level of your blood. It's going to tell us how much carbon dioxide you may be retaining, as well as how much oxygen is in your blood. And the results from this blood sample are going to help us to better understand what's going on, and that way we can help you breathe a little bit easier.
Okay.
That sound okay? Okay, so what I'm going to have you do first is just verify your full name and birth date for me.
Austin David Foster, 2/1965.
Okay. All right, Mr. Foster, I'm just going to quickly check over your chart here to make sure I haven't missed anything important. All right. So I'm going to have you hold both wrists out like this for me, and I just need to feel which one has the strongest pulse. Okay, we're going to go ahead and use this hand. Let's go ahead and just rest it just like this. Palm side up. Okay, so now I'm going to do what we call the Allen's test. And the Allen's test is done to make sure that we have enough blood flow needed to do this type of blood draw. So I'm going to occlude your radial and your ulnar arteries, and I'm going to have you do a series of opening and closing of your fist 3 times. And that's going to help me determine whether or not you have accurate blood flow. So we're going to go ahead and do the Allen's test. Go ahead and make a fist. Okay, I'll occlude and open, close, open, close, open, close. I'll release the ulnar artery. Go ahead and open your hand. And notice how your hand is returning color there. That's telling me that you do have accurate blood flow. So we will be able to do this draw today. So I'm going to go ahead and get a set of vitals here from you, including your heart rate, your respiratory rate, your blood pressure, and your temperature. We'll go ahead and get started.
Okay.
All right, so I'm going to go ahead and get my hands washed here. Okay. I'm going to get all my stuff set out. So we've got everything that we need here. And go ahead and get gloved up. All right, Mr. Foster, I'm just going to go ahead and use this quick alcohol prep pad to clean the area. And then I'm also going to clean the tips of my gloves here to make sure that I'm not going to be contaminating anything. Then I'm going to go ahead and draw back my syringe to 0.5 milliliters or whatever the doctor would prescribe and remove the cap here. Okay, and then using the bevel side up on the needle at a 45-degree angle, I'm going to find that pulse. Right there, you have a nice bounding pulse. Okay, you're going to feel a poke. All right. And if you see that flash of blood in the syringe, that's telling me that I got the artery. And so we're going to go ahead and let that fill up here. Okay, then I'll just use that gauze to hold some pressure on there. Seal this with my guard so that nobody gets poked. And I'm going to hold this pressure on there for 3 to 5 minutes or until the bleeding stops, during which time I'm going to be checking for any amount of residual pain, swelling, heat, redness. And then once that 3 to 5 minutes is up, I'll go ahead and apply the Band-Aid. Okay, then I'm going to take that blood sample from you, go ahead and get it locked in here. And then I'm going to go ahead and remove any air that may be in there. I will go ahead and get your information on there, and it will go into my biohazard bag, which will be sent to the lab. Then all of my sharps will go into the sharps container, and my area, I'm going to go ahead and get that all disinfected here. Do you have any questions for me today?
Nope.
All right, thank you very much.
Thank you.